Joel. This is gonna be my Strait Cath. So we have a 26-year-old female named Mary Sanford. Her date of birth is 11/12/98. She has no allergies, and so she's here because she just gave birth, and she's having trouble avoiding post-procedural this birth. She's a full code, and we just have orders to insert a straight cath now because she's having some bladder distension and pain along with that. Otherwise, everything looks normal. She's alert and oriented, but she's just grimacing with pain due to that bladder distension. So that's about all. I have some help along the way. I have my CNA coming to help prep her area. But other than that, I'm gonna go in and meet her, and yeah. So. Hi. Can I get a name and date of birth?
Mary Sanford, 11/12/98.
Awesome. So I'm going to give you some privacy, hand hygiene. My name is Joel, and I'm going to be your nurse for today. How are you feeling?
I'm feeling okay.
Okay, are you having any pain?
A little bit in my stomach.
Okay. Does it feel like you have to pee?
Yeah.
Awesome. Yeah. So I can help a little bit with that. It sounds like your doctor gave me an order to insert a straight cath, and so what that'll do is it'll just drain your bladder, and that should relieve all that pain.
Perfect.
Have you had a catheter before?
I think maybe, but I don't remember.
Yeah. It sounds like you had a Foley catheter during giving birth, and so it'll be the same thing. But this catheter, it doesn't stay in. It's just a straight catheter, which we'll take out right away. So it'll go in, we'll drain your bladder, and take it out.
Okay.
And yeah, it won't be left in. So, but otherwise, all the procedure stuff is all the same. Yeah, we'll make it quick for you. Okay, do you have any questions?
No.
Awesome. Is this something that you are interested in?
Yes, please.
Okay, sounds good. So yeah, I visualized her anatomy. It all looks pretty normal. And do you have any allergies before we get started with this procedure?
No.
No, you don't have any allergies. Awesome. Just want to make sure you're not allergic to any latex or anything. Okay, well, I'll go and just get my equipment and we'll get going.
Okay.
Okay. Privacy and hygiene. Coming over here, just looking over this catheter, and it's all not tampered with, and 2029, so it's still good, not expired. So, yep, foam in. Hi, it's just me, Joel again. Can I just get a name and date of birth once again?
Mary Sanford, 11/12/98.
Awesome. Privacy. Okay, so Mary, I just want to make sure one last time, so I'm not harming you. Do you have any allergies?
No.
No, you do not have any allergies. Awesome. Okay, so yeah. Is it okay if I just expose you a little bit? I'm not gonna expose your top half, just the bottom half that I need to see.
Yeah, it's fine.
Okay, sounds good. Okay, again, anatomy looks good. Very normal. And so, awesome. I'll have my CNA just do the first wash down with just some soap and water. And so now that's done, I'm going to, I just should have done this a little bit beforehand. It's a weird bed, but I'm gonna raise her so I'm not reaching down, and if I reach down below my waist, I'm not sterile anymore. So gotta pump this bed up. Okay. And I'm gonna start with this down here, and I'm going to peel it away. Oh, that's wonderful. Peel it away from the patient. Okay. And so I have this right here, and beforehand I washed my hands and did hand hygiene. So now I have this, my patient chart, and right here I can touch the outside of this. Theoretically feel open, but I cannot touch the inside. Okay, find my fingers here. This is the tricky part. Okay. One, and then I can go under here, find my thumb. Okay, it's on the outside. Sterile. Okay, I can get rid of this. Okay. Okay, and now I'm going to start with my drape. So, shiny side, that side's going to go down. I'm just going to kind of set it there and tuck it in, make sure I'm not touching her skin. Okay. Now I have this. Again, shiny side down. Okay, and so now I'm going to, I would use that, what's it called, lube, but for our mannequins, we won't be doing that. Okay, but now just chuck that. Now I'm just gonna wipe her down. Now this is gonna be my dirty hand, my non-dominant hand. And so I'm gonna open up the labia majora. And starting on the outside labia, wipe down, only one wipe. Chuck that. Other side. One wipe. Oh, it fell. And one wipe down the middle. Nice and good. Okay. And now I'm just gonna get all that stuff out of there. None of this is needed. In our case, I'm just gonna move this a little bit closer. And bunch this up. Okay, and now I'm gonna insert this 2 to 3 inches for a female or until urine flows. And for a male, I would insert it 7 to 9 inches or until urine flows. So I insert it here. Okay, and urine's flowing. Wait about 5 minutes or so. Alrighty, urine is done flowing. Okay, then I can just remove this. Awesome. And now I'm just gonna chuck this down there, or in the garbage if it was closer to me. And now I can just remove this stuff, do any peri-care that's needed now. And then I can just throw all this stuff away. Okay, and yeah, any peri-care that's needed, cover her up. get her all clean. Alrighty. And then I clean up all my station. How did that go for you?
It went good.
It went
I feel
good?
better.
You feel better now? No pain?
No.
Awesome. Okay. So there's no burning sensation in your urethra or anything like that?
Nope.
No? Awesome. Yeah, so if you have any questions, just let me know. But I'll be back in just a little bit, okay?
Okay.
Awesome. So I'm just gonna lower you. Make sure that your call light is within reach. Yeah, so again, if you need anything, let me know. But otherwise, I'll be back in about an hour or so, okay?
Sounds good.
Awesome. Okay, so then I'll throw all that away, but I don't know if I need to keep it. And then what I'll do is I'll just document the character, how much, any odor of this urine, and then I'll document how she tolerated it, if it was an indwelling catheter, and I document like the time that I put it in, and like what size it is, and but yeah, so I document all that, but yeah, that's it.